Hello everyone, good morning to another series in ophthalmology. So, I will be explaining in another video how to go through thesis series and how to prepare for your MLA exams. So, without further delay, let's get started in the first chapter in ophthalmology. So, here I am going to tell you about extraocular nerve palsies. So, what is extraocular nerve palsies? What is extraocular muscle? The extraocular muscle are the muscles extraocular, which is present outside the ocular, that is the eye, and therefore the muscles, when there is any palsy of the muscle, how will the eye position be? So, first let us see about the cranial nerve 3 damage. So, what happens in cranial nerve 3 damage? In cranial nerve 3 damage, what does cranial nerve 3 do? The cranial nerve 3 will be supplying all the extraocular muscles except the superior oblique muscle, which is supplied by the 4th cranial nerve, and the lateral rectus muscle, which is supplied by the 6th cranial nerve. So, what does the superior oblique do? Superior oblique, superior oblique has two important functions. Even though it is present superiorly, it will attach to the inferior part of the eye, and it will result in two important actions. One is it will help to look downwards, and the second one is intorsion. So, this is what the superior oblique does. So, now when the cranial nerve 3 is damaged, but superior oblique nerve is intact, because superior oblique muscle is intact, because the cranial nerve 4 is normal. But what about the lateral rectus? Lateral rectus will help in abduction or out. So, now when the cranial nerve 3 is damaged, this downwards and outwards, these two action is intact by these two muscles. So, therefore, here the eye is down and out. What about the cranial nerve 4 damage? In cranial nerve 4 damage, the superior oblique is affected, right? So, the superior oblique, its main action is downwards. So, now the eye cannot see downward. So, therefore, because of the action of the inferior oblique, the eye sees up. And what is the other action? It is intorsion. What is intorsion? Intorsion can be explained like if a horizontal rod is passed through the eye, just like this, and if it is pulled medially, then how will the eye be? It will be, that moment is how will the eyeball be? That moment is the intorsion. If it is rotated laterally, then that moment is the extorsion. So, both intorsion and extorsion has to be in balance to view something, to read something. So, here the intorsion is lost. So, what will the eye do? What will the head do? The head will tilt such that it balances the intorsion with by head tilting. Of course, it cannot produce an exact picture like how the superior oblique would have done would have caused the intorsion if it is normal, but still to some extent it can balance. So, therefore, there will be head tilting towards the unaffected side. So, when there is cranial nerve 4 damage, the eyeball will be looking up and head tilted towards unaffected side. So, this happens in cranial nerve 4 damage. What about cranial nerve 6 damage? In cranial nerve 6, when it is damaged, cranial nerve 6, that is cranial nerve 6 supplies the lateral rectus. So, its role is abduction, that is out. So, it cannot see out, it cannot see laterally, therefore, the eye will be medially. The eyeball will be medially. That will be the position of the eyeball. With this, the extraocular muscle palsies, these are the important points I have covered it. Thank you for listening. Have a good day.